guys, it's Andy
and Kayla, and we are doing a video for you today about two diagnoses that can often get flip-flopped or mistaken for the other one. The first diagnosis is PTSD, which is post-traumatic stress disorder, and the second diagnosis is ADD or ADHD, which is attention deficit disorder, or if it's with H, then it's hyperactive.
Yeah, and the reason why I want to do this video is what I see lots of times in the mental health counseling world is that somebody will come to me and either they themselves or their loved one, they are convinced has ADHD or ADD. And after working with them for a little while, we kind of discovered that it's really post-traumatic stress disorder. And there's a few things that go along with PTSD that I think a lot of people get hung up on because they can look a lot like ADHD or ADD. So that's why I want to kind of go over the difference today.
Right, and along with what Andy said, in a school setting, a similar thing can happen. A well-meaning educator or parent can be convinced that a child has ADD or ADHD if they're just looking at certain behaviors and not really looking at the whole child. And there's a lot of videos out there already about PTSD or ADHD, so our video today is going to be comparing and contrasting the two.
Exactly. So you're going to see us kind of glance over here. It's just that cheat sheet we have with a whole bunch of bullet points, things we want to go over, and talking about the diagnostic criteria. And that comes straight from the DSM-5. It's not just something that we make up and hey, if somebody has these things, we decide that's what they got. We pull them right from this. So with that being said, let's jump right into PTSD. So somebody has PTSD if they have experienced a traumatic event in their life. And trauma, or what is traumatic, is totally individually defined. It's traumatic for me, it may not be traumatic for you, and it may not be traumatic for you. So our lives kind of will pave the way and set ourselves up for what is traumatic for us. So just keep that in mind. If you can't figure out, well, man, why would this be traumatic for somebody? It still is, even if it isn't for you. And another thing that a lot of people I think get kind of mixed up on is that the traumatic event doesn't have to happen directly to the person. They can witness it happening to someone they love or care very deeply for, or they can know that a traumatic event happened to someone that they love or care very, very deeply for, and post-traumatic stress disorder will result. And somebody that has post-traumatic disorder, some of the big things we want to focus on today is going to be they're going to have frequent, reoccurring, intrusive thoughts or memories, flashbacks, reoccurring themes in their play if they're a kid about that traumatic experience. So it's going to happen a lot, reoccur quite often in their mind. And they're going to want to avoid triggers, avoid thinking about it, avoid things that are going to make them feel that same way that they felt when that traumatic experience happened. And the big thing that I think really gets people confused and kind of caught up on ADHD or PTSD is the hypervigilance piece. And so somebody that is very, very vigilant, hypervigilant. So somebody's going to be, if they're hypervigilant, they may have some irritable behaviors. They may have some angry outbursts. They're going to have an exaggerated startle response. So if you go up behind them or you scare them or startle them, they're going to jump right into their fight, flight, or freeze response. So that's why you don't go up behind a vet, scare them, but that's a whole separate video. So they're going to have difficulty concentrating because they are so hypervigilant. And they're going to have a crappy sleep. They're going to either have a hard time falling asleep or have a very restless sleep. And so that hypervigilance, I think, can get people confused. And we're going to talk about that right after we go over the ADHD, ADD stuff.
So some of the big ones, the diagnostic criteria for ADD or ADHD, if the H is there, hyperactive, then there is hyperactivity, which can often look like some of the same behaviors that go along with hypervigilance, which Andy just talked about. Another one is they're often inattentive, so they have a hard time paying close attention to the task, or they have a hard time sustaining their attention for long periods of time. There's often distractibility, so they are highly distracted to external stimuli, sights, sounds, noises, people going on in the environment. They're often unorganized, they might lose items, and they can be very forgetful. So some of the things that we just said do kind of overlap for those two diagnoses.
Yeah, absolutely, a lot. So if there's a kid that is sitting at his desk, sitting at their desk, doing some work, and every time somebody walks by, every time somebody comes into the room, they stop doing their work and they'll walk onto that person, I'll follow that person all the way to where that person stops. That could be because they've experienced a traumatic event, and that's part of their hypervigilance, and they're just very, very aware of their surroundings, trying to determine whether or not that fight, flight, or freeze response needs to be activated, trying to figure out is that traumatic experience going to happen again or not. So that distractibility could be because they have experienced a traumatic event, or their brains are wired differently, and they have ADHD.
So somebody observing a child that you just described, sitting at their desk and being hyper aware of somebody new coming into the room, if you're just looking at them being distracted by that person, you could say, oh, well, they're distracted, that's ADD, that's ADHD, they can't focus on their work. Unless you really are aware of what's going on for that child or why that behavior is occurring, then it can very easily be mistaken for ADD or ADHD.
Absolutely.
And I think another example, like in a school setting, is oftentimes if a teacher or a staff member has a concern about a child being able to learn or retain information, oftentimes that they can kind of go towards ADD or ADHD route, because if somebody goes in and observes a child and they say, oh, well, they're not focusing during the lesson, or they're always paying attention to what other people are doing instead of doing their work, that's ADD, ADHD if you're just looking at the behavior.
Right.
But those behaviors can be occurring because they are hyper aware of everybody else, or they've been triggered, so now they're thinking about the trauma that they experienced, and they're not paying attention in class.
Absolutely. So that brings up a good point about avoidance, and that may look a lot like difficulty sustaining attention.
Yes.
Or because I'm triggered and now I'm thinking about this traumatic experience. So if somebody is engaging in an activity and then boom, that activity or something around that activity makes them think of that traumatic experience, then if they have PTSD, they're going to want to avoid that. They're going to disengage from that. So if a teacher is teaching a lesson and something triggers that person, then they're not going to be able to concentrate. They're going to forget what was going on from that point forward, because they're not thinking about the lesson, they're thinking about that traumatic experience.
Right. And if it happened during math class, then math class might become a time that they try to avoid.
Correct. Exactly right. Exactly right. And the hypervigilance, where they're going to have problems concentrating, just like with ADHD or ADD. So those things I think can get mixed very, very easily if you don't look at the root cause. Was it a traumatic event that causes behavior, or is it just a difference in the brain physiology, brain wiring?
So as a school counselor, and if there are school counselors watching this, I think it's important for us to realize that we're often the only professional, or one of very few professionals working in our schools, who have education about mental health and mental illness issues like PTSD. So I think it's important that we keep ourselves educated about what trauma might look like in children if it's playing out in a school setting, because I don't think it's a coincidence that often the very young children who might have symptoms of ADD or ADHD, or even diagnosed with that I don't think it's a coincidence that those kids have often experienced trauma in their early life, or they have experienced homelessness, or they're living with grandparents or other family members because they can't be with their biological parents. If you start looking at the whole child, you might start seeing that, there's some trauma that happened there that might be why these behaviors are happening.
Yes.
It's important to look at that.
Absolutely. And so because of that, because of the cause of those behaviors, the treatment's going to be very, very different.
Right.
So if somebody has experienced a traumatic event, having them take ADHD meds isn't going to help them. Getting treatment like EMDR, eye movement desensitization, and reprocessing, very, very helpful to help people kind of process through that traumatic event and kind of reprocess it and make it so it's not as triggering and have as many of the negative symptoms. You might be experiencing those after going through EMDR. But if somebody has ADHD and having them go into EMDR, that may not be the treatment that's for them either. So having somebody kind of go and really look at what's going on. So if you or somebody that you know is having difficulty concentrating, have them go to somebody like a mental health counselor, somebody that can kind of tease this out to see, is this a brain wiring challenge or is this the result of a traumatic event? And I think that's really hard to get teased out in a 15-minute PCP appointment.
Right.
So that's just one of the things that I would encourage people to do if you know somebody's having a hard time with concentration.
Or if you just observe the child, I don't think you can really differentiate those two.
I would agree. Absolutely. Because just talking about it, they can look very, very, very similar.
Right.
It's trying to figure out where is that root cause, and you can't just figure it out just by looking at the behavior.
Right. So we're going to post a link to an article that discusses a lot of what we talked about today with PTSD and ADHD kind of overriding and how they can be mistaken for the other, as well as the link to some EMDR
resources, absolutely.
Yeah, because that's a very known effective
it is.
modality for trauma.
It's huge. So the World Health Organization last year recommended it for post-traumatic stress disorder treatment because it is so helpful worldwide. That's the treatment that they recommend for PTSD. So it's very, very helpful.
Yeah.
So anything else you want to leave folks with? All right. So as always, this may not apply to you, may not fit in your life, but if it does,
work what works for you.
And leave the rest. Leave everybody with. Anything that you want to?
No, we just want to, we hope this video is helpful for you, and like we always say at the end of the videos,
as always, this may not apply to you.
But if it does, work what works for you.
And leave the rest.
Bye.